Keeping in mind the privacy and confidentiality of the patient and using of layman terms, the obstetric history is taken from a pregnant woman. If she says it should be taken in the presence of a chaperone, the sensitivity and cultural background of the woman should be in the mind of the physician. In obstetric history taking, you have to ask about the demographic details, the name, age, occupation, ethnic background, and the presenting complaint, or there could be any reason for attending. Second thing, you have to ask about the pregnancy she is going through. You have to ask about the gestation, the last menstrual period, its date, and from the last menstrual period, you can estimate the estimated date of delivery. Last menstrual period is a very old method of calculating the estimated date of delivery. Nowadays, the date estimated from the ultrasonography are more accurate. Through ultrasound, you can take a guess about the single or multiple chorionicity. Then, a detail of presenting complaint should be explored or the reason for attendance. Third thing is the ultrasonography. Were there any scans performed? Why they were performed? And were there any problem identified in those scans? Fourth thing is the past obstetric history. There should be a list of previous pregnancies and their outcomes in order. Fifth thing is the gynecological history. You have to summarize about the menstrual history, the periods, were they regular or not, was there any use of contraceptives, was there any infection, and what was the treatment, when was the last cervical smear, was it normal, have there ever been any that were abnormal, if yes, what treatment has been undertaken, previous gynecological surgery. Sixth thing is the past medical and surgical history. The relevant medical problems should be explored, any previous operations type of anesthetic used or any complications of the operation or anesthesia. Seventh thing is the psychiatric history. The psychiatric history is very important in the obstetric history. In obstetric history, you are taking the care of not only the mother but also the baby she is going to give birth to. So it is very important to ask about the psychiatric history. You have to ask about the postpartum blues or depression related to pregnancy, major psychiatric illnesses. Then family history should be taken. Were there any significant illnesses like diabetes, hypertension, genetic problems, and psychiatric problems? We have to explore the social history. Is she involved in any type of habit like smoking or any drugs? Marital status should be asked about, occupation and partner's occupation, who is available to help at home, are there any housing problems. Then you have to ask about the drugs, all medications including the over the counter medications and folate supplementation. You have to ask about the allergies, to what she is allergic and what problems do they cause. In case of obstetric examination, the maternal weight and height is measured. The blood pressure of the mother is calculated in every visit to rule out any hypertension related problem. Urinary examination should be done for to rule out any genitourinary problem, and general medical examination should be done. In general medical examination, the examination of cardiovascular system and breast should be done thoroughly. Then is the examination of the pregnant abdomen. For the examination of pregnant abdomen, the consent should be taken and it should be carried out in the presence of a chaperone. You should ask about the pain and tenderness. The steps include inspection, palpation, and auscultation. Then most importantly, a pelvic examination is done. Again, in pelvic examination, first you have to take the consent in the presence of a female chaperone. You have to keep in mind there are few conditions in which the pelvic examination is contraindicated. Again, it is very much related to the examination which was done in gynecology. There are also some contraindications of the bimanual examination. Inspection, specular examination, bimanual and rectal examination are its steps. So hope you like this video. Kindly subscribe to my channel and hit the bell icon. Thank you.